And welcome back to the show. I love that music when it's playing. Hi, today we're talking about diabetes medication. Every time you turn, there seems to be a new medication that's on the TV, right? There's a new ad, there's a new description, there's a new something. And in this video, I'm going to break it down to tell you what the classes of drugs are, what the benefits are, how they work, and possibly what are some of the side effects. So if you're diabetic, or you know someone who is diabetic, if you've had questions about medication, oral medications, you're at the right place. So hang out, stay back with us, and we will get to the show. If you're new to me, I'm Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology. And here on the channel, I educate, I empower, and I encourage you to take charge of your health and your life, avoid complications, going to the next level. I have been, for the entire month so far, been doing a show on diabetes. I'm working on the diabetes series. Every November is Diabetes Awareness Month. And in November, every year, the goal is to educate the public, to dispel some of the myths that are out there, and to help people realize that they can live a healthy, fulfilling life, that they can decrease complications, and they can prevent the progression to diabetes. And so that's what I've been doing the entire month. If you've not done so already, go ahead and go back to those videos that we've done. There is a playlist on the YouTube channel that's called Diabetes 101 Series, Diabetes 101 Series. And in that playlist is all the videos that we have done so far for the month. If you know someone that is diabetic, if you are diabetic, if you are struggling with pre-diabetes, if you've been told you had insulin resistance, you're at the right place. There are several videos that we've done so far for the month. And as we get into the rest of the month, we'll be talking about lots of things that are relevant to diabetes, to pre-diabetes, to metabolic syndrome. We're going to be talking coming up about different weight programs. We're going to be talking about different diets, right? So when we were talking about diets before, we were really just talking about how you're eating. And in the future shows, we're going to be talking about specific diets like keto diet and Mediterranean diet and even intermittent fasting. Okay, I shouldn't say but also intermittent fasting. In this show, we're talking about oral medication. We're talking about medication for diabetes, right? So these are people who've already progressed to diabetes, and we're talking specifically about oral medication in this episode. We'll go back and do a little review so that you can be with us as we go through this section. But we'll come later on and talk about injectables and then insulin, right? And then we'll have a show on technology that's being used in the management of diabetes. So glad that you're here. If you're new, I want you to go ahead and put new in the comments, and we would love to welcome you and give you a hand clap, give you some music to welcome you. We love when people stop by and when they engage with us on our different social media platforms. If you have not done so, you can find me on all of our social media platforms, and you see it there on the screen. Dwayne Wood MD, Dwayne Wood MD. I hate pointing because I always point to the wrong side. Okay, over there. All right, so right under my name, Dwayne Wood MD. TikTok, Twitter, Instagram, Facebook, of course, here on the channel, on this YouTube channel, and you can find us on all of those social media platforms. All right. Okay. So with that said, let's jump over and let's get into our discussion for tonight. Let's see. Let me get rid of this. Got a couple of screens over here as I was preparing. You guys see me when I'm getting ready, right? So you see me looking over and talking and doing different things and smiling. And sometimes I'm smiling because somebody sends me a text on my somebody sends me a text on my screen here. Okay. All right, here we go. So let's see. Let's get rid of that one. Let's save. Okay. All right. So diabetes. It is a growing issue, a growing problem that we are having around the world, right? Remember, there are almost 500 million people on the planet now that have diabetes. And here in the United States, there are 37 million people that suffer from diabetes. And so one of the reasons that we're talking about this is because it is such a big deal. So let's hop over, let's pop some slides on the screen so you know where we're heading. And so this is where we're heading. We are talking about what oral medications can I take for my diabetes. Now, having said that, let me hasten, right, to say that as we've gone through the month, we've talked about various treatment options for diabetes, right? We've talked about lifestyle. We've talked about non-prescription treatment. And here in this episode, we're talking about oral medication, okay? So for those of you who are joining us for the first time, right, we're not just jumping right into medication. We've talked about those. Go back and look at those videos that we've done so far. And here we are talking about medication. Now, when we are treating diseases, for various reasons, people need medication. So we've talked about our type 1 patients who are insulin dependent, right? So their body doesn't make insulin, and so they require insulin. So for my type 1 patients who are out there who are watching right now, these medications may not be for you. Notice I say may not, right? So some of the medications that we use in type 2, we use in type 1 diabetics, not to replace their insulin, for different things. So for example, when we talk about the GLP, so the non-insulin injectables, right? Those can be used in type 1 diabetics. But in that case, we're not using it for the blood sugar control, right? So in those cases, a lot of times we're using it for weight. So people who have put on weight, so their doc may prescribe this to them, not for treatment of their diabetes, because remember, they require insulin, right? So I want to keep saying that. You hear me say that probably every episode that we've done so far in the treatment of diabetes, okay? All right, so let's go there. So actually, let me back up for a minute because I forgot to do something at the top of the show. So let's back up. Where am I? Yeah. So, okay. So I usually do my shout out, right? So I usually do my shout out, and I didn't do that today. So shout out. And so you see, I am wearing again, right? So our Dwayne Wood MD. Let me get my mic out of the way. Right, so wearing my Dwayne Wood MD shirt. So shout out to Dwayne Wood MD, and the reason I'm shouting out, right, to Dwayne Wood MD is because there are so many places now that I am putting out our content. So we're on Instagram, we're on TikTok, we're on Twitter, right? And if you've been following me, then you see every day we've had some video that's coming out, a short. Of course, here we've been doing the Diabetes 101, right? You will see as we get into December, right? So December, we're getting to the end of the year, right? There's something special that's coming, and we're going to be working on that throughout the month, right? And there's a resource that I'm going to make available to you guys, and we'll tell you about it. So today's the 21st, so we'll tell you about that, not quite yet, right? But it's there. We're getting it ready for you. All right. So come on back. Make sure that you are keeping up with us. Make sure you're keeping up with us. You're going to see a mailing list that we're going to be putting out to get you to sign up for that so that we could send this information to you. So just hang out. When you see that, make sure you get on. All right. If you're there, and I just saw someone gave us a thumbs up, thank you for that. If you're there and you want to hop on and you want to answer a question, you want to send a question, please make sure you put a Q in front of the question, a Q and a colon, so that we know that's a question that we need to get to. All right, so let's hop on back, and we're talking about prescription medication for the treatment of diabetes, and specifically tonight in this episode, we're talking about oral medications, right? Oral medications. All right, and we've talked about things before, so go back and watch those other. Now, I wanted to put this graph up, or this slide up, because this comes directly from the American Diabetic Association. And as mentioned, there are two main associations here in the United States, the American Diabetic Association, or ADA, and the American Association of Clinical Endocrinologists, or ACE, AACE. Those are the two bodies, the primary ones. I mean, there are others that deal with diabetes and that have statements and position papers and algorithms and so forth, right? I am, as we've been going through this discussion, I am primarily adopting a lot of what the ADA says, and they put out a consensus statement every year, as I mentioned in the previous video. They put out a consensus statement every year, so I adopt their general guidelines, but as I'm doing the graphics, right, a lot of times I'll mirror what the other organization A says. Now, that doesn't mean that they are doing different things, right? There are certain places where they may have overlapping or slightly different recommendations, right? But for the most part, they coincide with each other. Okay, so let me say that. But this one is from the American Diabetic Association, and I wanted to put it up because you'll see what it says there. It says holistic, person-centered approach to type 2 diabetes management. And the word that I want you to get is holistic. And as I keep saying we, as I have been talking to you through the month, I have been stressing the holistic, right? And we'll see another slide in a minute. But a lot of what we do in the industry, a lot of what we do as we're taking care of patients, we're thinking holistically, right? We're thinking holistically. And our goal is long, healthy, fulfilling life. That's what we want, okay? All right. So this is a slide that we saw before in one of the other videos, and this really is the algorithm as someone comes into the system. Where are they? Their A1Cs less than 7.5 or 7.5 to 9 or greater than 9, right? And it tells us as that patient is navigating through the system where they should be, what they should be on, what we should be trying, and so on and so forth, okay? So we've seen this slide before, but once again, at the top of that slide, you'll see lifestyle therapy and ongoing glucose monitoring. Lifestyle therapy and ongoing glucose monitoring is what we want to make sure that we're doing. And prescription medication comes in lots of different flavors, right? Orals, what we're talking about tonight in this episode, non-insulin injectables, insulin, and then we'll come back and we'll do a show on technology. I love this idea, right? So this is something called the ominous octet. Now, to get a real good understanding of the ominous octet, what I want to say to you is prior to our current thought processes, and I would say modern thought processes, there were all these different things that we thought were going on in the body. And some of them we really didn't know. We knew that the body in a type 1 diabetic either didn't produce insulin, in diabetic. In type 1, they didn't produce insulin, or in type 2, they had ineffective insulin, right? So we knew that. We had an idea of what was going on in the liver. We had an idea of what was going on in the adipose tissue, right? The abdominal fat. But putting it all together was done by a guy by the name of Ralph DeFranzo. And he came up with this term. It's called the ominous octet. And there are other iterations of this. They've added more and more things. But the ominous octet was a way of saying, hey, when we're thinking about management of diabetes, let's think, once again, I'm going to use that word holistically, right? And holistically in general means that we're looking at lifestyle, we're looking at sleep, stress, anxiety, depression, we're looking at food and exercise and medication. But when we're talking about the medications themselves, let's look at all the things that could be possibly causing a problem. Let's not just look at the pancreas and the pancreatic cell that's causing a problem, because we know that. We know that sometimes the pancreatic cell in the type 2 diabetic becomes exhausted. That's beta cell exhaustion. In other words, the pancreas has done its job. Like I had an old car that a friend of mine, right, one of my childhood friends, when he left college, we got it, right? So me and my other roommate, and I'll tell you, there were things on the car that we didn't want. Like in order to keep the car running, you had to like hit the gas, right? You have to keep it revved. Well, if you're sitting at a light and you're revving the car, right? It's a stick. So you got to keep your foot on the brake and rev the gas at the same time, right? Right. So you're going through this thing. Or the steering wheel, right? When you turn the steering wheel, it will lock. All right. And we were in college, so we didn't have a lot of money. But you know, that car drove and it drove and it drove and it drove until one day here in Huntsville, right? If you're in Huntsville, you'll know where I'm talking about. I'm heading down Jordan Lane. And this was before they had the highway there, you know, right there by the Space Center. And you could make a left from Jordan Lane onto Governors. And I was coming down the road and I made the left, right? So the light was green and I was going through the light and I made the left and the wheel locked as I'm making the left. Right? And so the car, right? And so we finally got, we got that straightened up. But one of the other things was the car, you couldn't reverse, right? You couldn't reverse the car. And so we lived in an apartment complex, and so when you go into the driveway for the apartment complex, the parking for our apartment was an incline going down into the parking lot, right? So remember, you couldn't back up. So what we had to do was we drove down into the parking lot and we quickly turned around so that we were facing uphill now. So if my roommate's watching, he's going to get a kick out of that. All right. So that's what we used to do. Okay. And it was crazy. But anyway, that car drove and it drove and it drove. And one day it said, look, guys, I'm exhausted. I'm done. I'm not doing this anymore. And it stopped, right? It just stopped, right? So exhaustion. So beta cell exhaustion is this idea that the beta cells in the pancreas, they're pumping and they're pumping and they're pumping and they're pumping, and they are doing their darndest to try to keep the blood sugars reasonable. And when they can't do any more, that's when we begin to see problems, right? So that's one of the ideas, the pancreas. But the ominous octet says that the pancreas, well, we know the pancreas is a problem, but so is the liver is a problem. And so are the muscle tissues and the fat cells. And now we've got some issues in the GI tract, right? And we've got kidney issues and we've got some signals from the brain that's not quite working. So let's now, instead of focusing on one area, let's go ahead and let's try to hit all of those areas. So that's what the ominous octet is. And if you think about the medications that we have, all the medications hit one or more of the areas in the ominous octet. So when people are looking for a medication for treatment of diabetes, what we're saying is, okay, what defect can we target? Of course, if we can get more insulin, then that's great. But there are some other things we can do, because remember, insulin is a growth factor. Insulin makes you hungry. Insulin makes you put on weight. And there's all these things that go on when we take more and more insulin. And we'll talk more about that when we get to the insulin, the episode where we talk about insulin. All right. So if we can minimize the amount of insulin that we're taking, that's amazing. Okay. Does that make sense? Awesome. Right. So the ominous octet is really kind of the structure, right? The basis of a lot of what we do in medicine in terms of the treatment. So we can say, hey, this person is having, they still have, the pancreas is still able to make some insulin. So let's see if we can get a medication that will make the pancreas do that, make more insulin. Or can we make the muscles more sensitive to using insulin? Or can we decrease the sugar from the liver? Or can we help the kidneys to excrete, to get rid of, to pee out more of the sugar? Right? So notice what happened. So I'm hitting each of those different areas and we're saying, how can we use that area or that organ or that gland or whatever to effect better blood sugar control? Okay. All right. So I think I've said a lot about that, right? So ominous octet. All right. And then here are the oral medications. Now, there are a few areas or few categories that I didn't include here, and I'll talk about two of those specifically at the end of this section. But these are the major ones. Okay, these are the major ones. There's what's called the DPP4 inhibitors, the SGLT2 inhibitors, biguanides, and everybody knows that as metformin, the TZDs, Actos, and then the sulfonylureas. Okay, so those are the categories that we're going to go through, and we'll talk about them each in turn. And I'm going to add a couple at the end that aren't on this table. Okay. All right. So the first group is the DPP4 inhibitors. Dipeptyl peptidase 4 inhibitors. You don't have to remember the whole name of that. But the way these work, and if you remember on the ominous octet, there was a thing at the top. It looks kind of like the GI tract. So what we learned early on, not now, but years ago, was that not only are people who have type 2 diabetes deficient in insulin, or the insulin doesn't work, or we're not making enough insulin, but there's also there are these peptides in the GI tract that are deficient in diabetics. And so if we can either make or give the body more of this, and this is not insulin, if we can give the body more of this or stop the body from breaking down what it already has, then we can get better blood sugars. That's a nutshell of that idea. Okay? So either we can give you more, or we can stop the body from breaking it down. And so this one, right, inhibits the body from breaking down the stuff it already has, right? So the body's making some, it may not be making as much as it needs, but this will stop it from breaking it down, okay? And so what this does is it allows the body to kind of on its own to begin regulating blood sugars. And so when we stop this enzyme from being broken down, it stays in the body longer, and therefore it can cause better blood sugars. And you'll see there on the screen 4 of the representative drugs in this area. So Januvia, a lot of you have heard about that. You've seen it on TV. Tradjenta, you may not know so much about. Onglyza and Nicina. So, and these guys will come in combination. So you may have heard the combination, for example, Janumet, right? So Janumet is a combination of Januvia and metformin. You may have heard things like Trijardi, and Trijardi is like the tri. So there are 3 things in there. There is Tradjenta, which is on the screen. There's Jardiance, which is another one that we'll see in a minute when we get to the SGLT2s, and then metformin. So we put those together, and you'll see those combinations, right? So what I'm doing, I'm not going through the combinations. I just wanted to say that so that you know that you can have a combination of these drugs. But we're going through each drug, right? Giving the list of the drugs themselves. So the way these guys work is that they inhibit the breakdown of this enzyme or this hormone, right, in the body, so that it stays longer, and that peptide, if you will, helps to lower blood sugars. Make sense? And one of the ways it works is it helps the pancreas to release more insulin. Yeah. So when the pancreas sees sugar coming, when you eat something, remember, it goes down, it gets digested. Now we've got glucose that's hanging out. The pancreas sees the sugar coming, and this allows the pancreas to be able to release, if it can, right? If it can, it allows the pancreas to release more insulin. So that's the first way that it works. The other thing that it does is it goes to the liver, and it decreases the amount of sugar the liver produces.
So not only are we getting more insulin from the pancreas, but we're also decreasing the sugar that the liver produces. So those two combination of things helps to lower blood sugar. Isn't that beautiful? Now, this is what that hormone did in the first place, right? But because diabetics are deficient in the hormone, we not stimulate, but we enhance it by giving you Januvia or Tradjenta or Onglyza or Nicena. Yeah, beautiful, right? Because we're targeting one of the defects. Remember that ominous octet? Actually, in this case, we're targeting two defects, right? We're targeting the pancreas, the inability of the pancreas to produce enough insulin, right? And we're targeting the problem that we sometimes have where the body is producing too much sugar. And if you don't understand it, go back and we did a couple of videos where we talked about that whole process. All right. So this is the DPP4s. DPP4s. If you got questions, put them in the chat. Okay. Send us a message on one of our social media platforms, or on our email. So dwood@dwaynewoodmd.com. dwood@dwaynewoodmd.com. So those are the DPP4s. The next group, these are the SGLT2s, and you'll see those there. And remember, I was talking about that Trijardi, right? So Trijardi is a combination of 3 of these medications. Give me a second. Let me pop over here, make a change, because that looks like right? My face is. See if that's better. Okay. There you go. So there was a white screen on this monitor, and it's just, yeah. Okay. All right. So SGLT2s. Serum glucose-like transporter 2 is an inhibitor. Now, this one was an interesting group because when I was coming through medical school, one of the things that we were taught and we were learned is that it's not good to have sugar in the urine. Right? So if we had sugar in the urine, that was a bad thing. Well, this group of drugs, this group of medications came along, and they actually used the kidney to excrete sugar. And basically, that's what this class does. It takes sugar, and it doesn't care where it came from, right? Whether you ate it, that candy, cookie, rice, pasta, bread, potatoes, or it comes from the stress that you have when you didn't sleep, or you have anxiety or depression, or you're in pain. So wherever the sugar came from, it didn't care. It just takes that sugar and it basically puts it in urine. I'm not going to get into the mechanism of how that's done, but it basically puts it in urine and you pee it out. So once again, one of the octets. Because in diabetics, well, let me back up and let's talk about what goes on in a normal person. In a normal person, when your blood sugar gets to a certain level, the body doesn't like it, and so it pees, and so you lose it in the urine, right? So a certain number, and we learned 180, right? Higher than 180, and the body begins peeing out. So for a lot of you, when you are diabetic, you notice that you pee a lot. Well, you pee a lot because your blood sugars are high. And during that time, remember when you pee, that's what? Those are calories that you're peeing out. And so when you pee out calories, you begin losing weight. So people come in to see me in the office and their blood sugars are 300, 400, 500. And they say to me, well, I'm doing a good job because I'm losing weight. Yes, you're losing weight, but you're not losing weight because it's a healthy thing. You're losing weight because your body's forcing the sugar out of your system, and it's forcing it out through the kidneys. But so in a normal person, when the blood sugar gets to be a certain number, the body pees it out. And so it helps to regulate, right? Not just your fluid, but also regulate blood sugar. Well, in a diabetic, that point at which the blood sugar goes out of the system is shifted. So in the diabetic, it's supposed, I'm going to give an example. I'm giving a number, right? It's supposed to pee out when you're at 180. But in the diabetic, because there's some defect in the mechanism, it doesn't start peeing out until you get to 200 or 250 or 300. Okay, now don't quote me on those numbers, right? I'm just giving you an example. And so what this medication does is it says, no, that's not right. So we shift it back down towards what's normal. And so the body begins now peeing out the sugar at the appropriate level or close to the appropriate level. Does that make sense? Because there's a defect where the body's not peeing, you're not getting rid of the sugar at the right place because it's shifted up. So the body's waiting longer and longer before it begins trying to get rid of sugar. This medication shifts it back down, or this class of medication shifts it back down so that you begin peeing sooner, which is a good thing. As a result of that, what do we find in the urine? Sugar, right? And if we're peeing the sugar out, then the sugar in the body, the glucose in the body, is lowered. So that's how this class of medications work. All right. And let's go back so you can see that list. All right. This is a representative list. So Jardiance, Invokana, Farxiga, and Steglatro. Right. And you may see those on TV. You may see them in ads. And when you see them, I want you to know that this is the class. This is the group. Right. So like all medications, and let me go back and talk about the previous group for a minute because I didn't say that. So one of the things that everybody wants to know is, if I take this medication, will my weight go up? Will my weight go up? And for this group, for the DPP4s, the ones that you see there, they are either weight neutral or slightly weight losing. All right, they should not cause any weight gain. Right, so should not cause any weight gain when you take these medications. All right, so going on to the SGLT2s, and once again, you see them there. And one of the concerns has been that when we put sugar in the urine, then the potential for having a yeast infection goes up. Okay. And in fact, that's one of the most common side effects of this group. But what we found is that for the most part, the reason people are getting those is because the blood sugars are so high. And they may get them as they initially start the medication. And as the blood sugars come down, then the risk of yeast infection goes down. Okay? Because you remember, if your blood sugars are 300-400, when you first start putting sugar in the urine, there's a lot of sugar that's going there. And as the blood sugars get better, then there's not that much. Okay? And they help to begin regulating. So most people, if you start, you'll probably see that starting when you first get on the medication. And there are some people who have persisting medications or persisting yeast infections. And so eventually, and talk to your healthcare provider, they'll come off of those. The other thing that is possible here is diabetic ketoacidosis, which is a significant, and that's actually an emergency within diabetes, right? DKA, diabetic ketoacidosis, where someone becomes so acidotic that they end up in the hospital. And so there are rare times when this class has caused diabetic ketoacidosis. Now, DKA, as it's called, is usually seen in a type 1 diabetic. So not usually seen in type 2. But we've seen type 2 diabetics who show up with DKA, and sometimes they're on this class of medications. The other thing to be concerned about, or one to be careful about, let me not say concerned, is dehydration. Because remember, the medication takes sugar, puts it in the urine. Well, wherever sugar goes, wherever salt goes, water goes, right? So as you're peeing out the sugar, you're also peeing out fluid. And for some of our patients, if they're not careful, they can become dehydrated. Now, this group, right, has been in the news, and it's been like everybody's excited about this group, because what we found is that drugs within this class seem to have some benefit for cardiovascular and kidney disease. So benefit for cardiovascular and kidney disease. And so a lot of times now you'll see if you have a cardiologist or you're talking to your family doctor, they may mention, even if your blood sugars are great, they may mention, hey, I think you should take this medication. And they're not doing it necessarily for the blood sugar part. Because remember, like I said, if the blood sugar is good, right, no issue there. But they're doing it because it is cardiovascular, protective for the cardiovascular system and for the kidneys, right? Now, I'm not going to go through which one and so forth, but just as a class, and we think it's a class effect. But your doctor, your provider may talk to you about going on one of these medications, not for blood sugar control, but because they seem to be protective. All right. So that's the SGLT2s. The next group, you've heard most people, if you have been around diabetes, or even if you're not diabetic, you've probably heard of metformin. Metformin is like an old drug, right? It's been around for a long time, and it has pretty good efficacy, right? There's small risk of hypoglycemia compared to other things, right? It's pretty benign. It is weight neutral. So your weight does not go up, and there's potential for a modest weight loss. Metformin is low cost. Right, so you can, in a lot of places, it's on their $4 formulary. You can get it for $4. Traditionally, it was recommended as first line, but as we've learned more about some of the other drugs, some of the other medications, then the recommendation is maybe that for certain populations we use one of those instead of metformin as first line. Now, there was a big to do maybe a year and a half or so ago, where where some of the metformin was contaminated. I was going to say but no, some of the metformin was contaminated. And so people began talking about metformin being bad. But it wasn't the metformin, it was the fact that the metformin was contaminated. And so the batches of metformin that were contaminated, they've been taken off and recalled and all that kind of thing, right? Okay. And then the other thing that people will talk about is metformin causing kidney damage. And let me jump in here and say, metformin does not cause the kidney damage, but people who have kidney damage should not be on metformin. Let me say that again. Metformin is not the thing that's causing the damage. But if you already have kidney damage, you should not be on metformin. But a lot of times what happens is someone shows up and they have kidney damage and they're taken off the metformin, and they associate taking off the metformin with metformin and kidneys, and they say, oh, metformin damaged my kidney. No, they didn't take you off because metformin was damaging your kidney, but your kidney is damaged, so you shouldn't be on metformin. Right? You see the distinction, right? So for all of you who are there, you've heard something about metformin, right? If you have kidney damage, and there are numbers, right? There are numbers that we go by. Then if you have those numbers, then you shouldn't be on metformin. But you shouldn't say, well, I got to come off metformin because it's going to damage my kidney. That's not how it works. One of the things that metformin can potentially do is it may lower your serum B12. So sometimes we've got to make sure that we're checking. We check B12, particularly people who are having worsening symptoms of neuropathy. Then that may be a part of it. Right now, notice I say may. So sometimes when we read side effects, we say, okay, that is causing it, is going to cause it. It's not going to cause it. It may. There are millions of people who are taking metformin, and not all of them have neuropathy. Okay, so that's metformin. Now, on the screen, you'll also see another medication called Actos, and they're not in the same category, but I only had one of each, so I've just put them on the same screen, right? So Actos is in a group called TZD, thiazolidine diones. Metformin is in a class called biguanides, right? So that's the two distinct ones. But TZDs. So TZDs, now I'll tell you, a lot of people, so TZDs, for the most part, one of them was taken off the market and one of them is not used as much. And Actos is, I mean, it's still on the market, but a lot of people don't use it because it caused weight gain and it caused some heart failure, you know, back in the day. As a matter of fact, this group is the reason why most medications, well, I shouldn't say most, all diabetic medications now have to prove cardiovascular safety because of this group of medications, the TZDs. So they cause weight gain and they can cause worsening heart failure. Now, how did they work? And it is amazing what they did. They increased, listen to this, they increased insulin sensitivity. What did we say the problem was in type 2 diabetes? It's an insulin resistant problem. So this group of medications actually attacked the source of the problem in diabetes. And they were very effective. And when we stopped using them and when we decreased using them, what we saw was that people had to go on massively more insulin or massively more medication than they were on before. So it was not uncommon to have someone who was on one pill of this medication and then you took them off and all of a sudden they're on 5 plus insulin. That's how good it was. But it caused some problems. And the problem was, just like metformin, and let me say this, and if you're out there, you know, don't get mad at me for saying this, but I'm going to say it anyway. People who had problems with heart failure and people who were having cardiovascular problems should not have been on TZDs. That would have solved the problem. Right? But we didn't know that. We didn't know that at the time. And as I said in one of the videos, one of these episodes, as we learn more information, it comes out. Okay, this is what we need to do. And sometimes we're mad that we find out something later. Well, there was no way for us to find out before. Okay. All right. This one also is, it likely helps to protect the beta cells. Remember, the beta cells are having a problem. So this group of drugs can help protect the beta cells. They also help in patients who have non-alcoholic fatty liver disease, right? Non-alcoholic steatohepatitis. So once again, the risks, weight gain, and of course, as I mentioned, heart failure. And then, let's see, did we talk about the SUs? Yeah, there we are, SUs. Let's do these guys. So sulfonylureas. So Januvia, which was in the DPP4s, and Tradjenta and Onglyza and Nicina. So all those are what we call, they do what we call glucose-dependent insulin release. So glucose-dependent insulin release. What does that mean? That means that when the pancreas sees sugar coming, then they turn on the faucet so insulin comes out. Okay? So it's kind of like being at your house and you're having a water fight out there. Somebody got a hose. And you don't keep the hose on the whole time. When you see somebody come by, then you turn the hose on and you splash them, right? So when the pancreas saw sugar coming, then it released the insulin. That's called a glucose-dependent insulin release. So when I see the sugar come in, then I release it. This group of medications do what we call glucose-independent insulin release. So basically, that's like being at the house and you don't care if anybody comes by, you just turn the water on. And you just got the water going the whole time. And you can imagine if that's the case. So these guys go in the body, they attach to the cells in the pancreas, and they just basically turn insulin on, right? So insulin is running the whole time. Well, you can probably also see some obvious issues. What did we say insulin was? Well, insulin is a growth factor, right? Makes you put on weight. Insulin stores energy, makes you put on weight. Also, if I'm getting insulin released and I'm not eating, what do I have? Hypoglycemia, so low blood sugar. Right? So those are two big effects of this class, but they are very potent. I mean, they work well. So we want to be careful with hypoglycemia. They also cause weight gain. And for patients who are elderly, they seem to have a bigger effect in causing hypo or low blood sugar. So we want to make sure that whenever we're putting someone on them, and in fact, if you read some of the recommendations, they'll say, hey, if someone is this old, then we shouldn't have it on them. And hey, they're this old, so we need to stop it, and so on. Okay. The other group of people, so we said, be careful with people who are elderly. So if someone has poor appetite, so for some reason they're sick and they're not eating well, then this group of medication is going to cause them to go low. So they're not eating well, or they're going long periods between eating. So sometimes people will take their medication and, they'll go out, work in the yard. And when they go out and work in the yard, they don't remember that they haven't eaten. And so their blood sugar it goes down. Right? Okay. And then let's hop over quickly and let's talk about these two gripes. So rubellicis and acarbose. So rubellicis is a group called the GLP-1 receptor agonist. And it is the only oral, so by mouth, GLP-1 receptor agonist. I put it here, but I'm going to actually talk about it more when we come to the non-insulin injectable conversation that we're going to have, right? But I want you to know that it is an oral medication, and it's the only one in the category that is oral. All the others in the category are injectables. And then acarbose is one that we don't use a lot anymore. But basically what it does, it decreases the absorption or the conversion of sugar or food to sugar in the body, right? So that's how it lowers the blood sugar. One of the side effects of acarbose, we won't talk about rubellicis here. We'll talk about it when we talk about the GLPs. One of the side effects of acarbose, remember, because it's decreasing sugar coming into the body and the breakdown in sugar, then you can have a lot of gas, bloating, flatulence, which is why it kind of went out of favor, right? So nobody wants that. But there are some specific cases where we can still use it. We don't use it a whole lot. I think I may have one patient that's on it right now. All right. Does that make sense? All right. So let's see. So Florence, I see Florence here. Let me hop over and say hello. Hey, what's up, Florence? Thanks for stopping by. She said, good evening, Dr. Wood. What's going on, girl? Let's give Florence a clap. Florence is a regular, but so I'm going to give her some music anyway. Yay. All right. And then she has a question. She says, what diabetes medications are safe when taken by pregnant women? That's a good question, Florence. I love a question. Yeah, let's answer it here, right? Let's answer it here. And maybe I can use that. I wonder if I should put that on my amazing question wheel and answer it there. No, let's go ahead and answer it. So what medications, and I'm going to try to answer it so I can use it as a clip, by the way. So what medications are good to be used for patients who are pregnant? Now, when it comes to pregnancy, the insulins are relatively safe for patients who are pregnant. Most of the oral medications or the injectable non-insulin medications we do not use in pregnancy. Metformin is one that we use, and we will use some of the SUs, the sulfonylureas, in pregnancy. But all the others we tend not to use in pregnancy. All right, there you go. What do you think, Florence? Can I use that? I think I'm going to use that as a clip. But yeah, so that's what it is. And so when patients come in, if they're on metformin, sometimes we'll leave them. And people who have diabetes or gestational diabetes, right? So not people who were diabetic and then they became pregnant. These are people who weren't diabetic during pregnancy, they become diabetic, and then after pregnancy, a lot of times diabetes goes away. Then those patients, their problem is an insulin resistant issue. Right? So their body becomes insulin resistant. So the amount of insulin they're making is not appropriate, right? It's not enough. And so sensitizing, right, metformin, or making their pancreas produce more, the SUs, or giving them insulin, right? Those are the three ways that we do it. The others have other issues that we don't tend to do in pregnancy. Cool. All right. So once again, if you're out there, we are in the middle of diabetes awareness, right? We're 21 days in now, and got several more shows that we're going to be doing. Make sure you go and you watch all the shows in the Diabetes 101 series, right? The playlist that's on the website, not the website, but the playlist that's on the YouTube channel. Subscribe. Please go in, create an account. If you don't have an account, right, hit the subscribe button once you get in there, and then also hit the notification bell so that you'll be alerted when we go and I do more shows and new videos. If you are getting benefit from this video and other videos, go ahead and give us a thumbs up, give us a like, and then share this with everybody. Okay. So this is actually a great place. Let me pop back over here. So we got two things that we got to do tonight, right? So if you've been with us, then you know that I've been doing the picker wheel. Our amazing question wheel is what we're calling it. So let me get that set. And we're going to do that right now. So let's go ahead and get over to our amazing question wheel. All right. So our amazing question wheel. So if you have been here, you know what this is. But if not, let me explain. So on the screen, you see our question wheel. And there are questions there. If you want to include a question from yourself, and that's why I was saying I was going to include Florence's question, but I answered it anyway. If you want your question to show up and the shout out for your question, send it in any of our social media platforms or to our email, dwood@dwaynewoodmd.com. I'm going to hit the button. It's going to spin and it's going to land on a question. Whichever question it lands on, I'm going to answer it, right? So here are the rules. It has to be a concise question. It has to be concise answer, a real practical answer. It can't be some nonsensical thing something that you can use. And I've got to answer the question within 45 seconds. That's right, 45 seconds. So I don't have to think of the answer in 45 seconds, but I've got to give you the answer in 45 seconds. Once I'm done, later on, I'm going to clip that piece of video out and I'm going to create a short, right? Or a reel or whatever you want to call it, whatever social platform. And we're going to post it on all of our social media platforms. And I want you to go out and find it. And when you find it on the social media platform, would you put in hashtag I was there, right? Because you're here. If you're watching this on the replay, go ahead and do that as well, because you're seeing me do it and say, hey, I was there when he did that. Okay. So let's go ahead and let's get that over here. Let's see. Let's hit the button and round it goes. Where it stops, I don't know. All right, let's see. What do we got? What health problems does diabetes cause? That's a good one, right? Because there are a lot of things that we can talk about. Let's see. What health problems do diabetes cause? All right. So to get my 45 seconds on the screen, get the questions on the screen, and then we'll go, right? So 45 seconds. Let me see. Got that. Okay, there we go. All right. So what health problems does diabetes cause? Well, typically we talk about what's called the 3 Ps of diabetes, right? Polyuria, polydipsia, polyphagia. We also talk about the triopathy of diabetes, retinopathy, nephropathy, and neuropathy. But remember that all of your cells are awash with high blood sugars. So we can really see diabetes complication in any tissue in the body, but those are the most common ones. All right, what did I do? Man, I did. Look at that. Ooh, let's pop over here. Hand clap for me. Now, I'll tell you, I was tempted to talk more, right? As I got to the end, I was like, oh, let me add this other thing, right? But this forces me, right? I love that because it forces me to answer that. Oh, look at this. We got a visitor to us tonight, Mr. Riley from Riley's World. Thanks for stopping and coming through, my man. All right. So we were on Riley's World. When was that? Was it last month? Yeah, so about a month ago. And so we had a good time hanging out with him. He's in West Side. Now, he knows I'm from New York, right? But that's his little thing. West Side. What is it? Right? The West Side, the right side, the best side. You put that in the comment for me, Mr. Riley. He says the question wheel is a wonderful engagement tool. Super dope. Yeah, I love it. I have fun, as you see. So love that. And once again, thanks for coming by. All right. So if once again, if you're out there and you've got questions about anything that we're talking about, go ahead and put those in the comments. You can send that to us on our social media platforms, and we will answer those. Right. We try to get to all of those as we see them. Medication. There's so much that's out there. And I wanted to make sure that we did a good job of explaining these various medications to you. So really appreciate you guys stopping by. And so we did our question wheel. The last thing we're going to do, right, before we continue and answer some more questions or so forth, is we're going to do our thought of the day. So let's do that right now. All right, so our thought of the day. We are a little over a month away from the new year. A little over a month from the new year. When the new year comes and we move into the new year, will you say that you accomplished all the things that you meant to accomplish this year? And I dare say that the answer is probably going to be no, because there are so many things that we want to accomplish, right? So we always set those goals, and we set those goals high so that we're not like shooting for the bottom. So we set all these goals. And did we achieve all the goals that we did? Probably not. That's not the important question. Here's the important question. Did you attempt something this year? That's a pretty different one, right? Did you attempt something? Now, I'll tell you, I was listening to something just a little before I came on the show, and I had to really reassess my year because there were a lot of things that I wanted to do that I didn't do, not because I didn't have the time and not because I didn't have the idea. I didn't do them because I was afraid they wouldn't work. Right? And so when I was listening to this person speak this evening, they said, well, if it didn't work, try something else. Try it a different way. But as the new year comes around, what we don't want to say, and as we get into the new year, right? So I'm projecting now for 2023. What we don't want to say is, hey, there's all this stuff that was on my list, but I didn't do it because I was afraid. If you did it and it didn't work, okay, that's off the list. Or we try something else. We try something different. But give it a try. All that happens is that it doesn't work, and one other way of not doing that thing. Right? So those are the questions. So sometimes we ask the question, did I complete my list? But I want you to change that. Not did I complete the list, but did I attempt the list? And I think that will be a lot more fulfilling, a lot more satisfying. And then we'll be able to get through that list. Boom, boom, boom. Oh yeah, try that. Right? Try that. Okay, that didn't work. Try that. Who does that? Sorry, I took that from Cat Williams. All right. And that is our thought for today. All right. And Mr. Riley got some hand claps. And he says, the West Coast is the best coast, the West Side. Thank you. All right. So diabetes medications, as I said, there are so many things out there. We are walking through, once again, Diabetes 101. That's the name of the series that we're doing. And we've got about 20, hopefully 21 videos, I think is what we've done so far for the month as we walk through. We've got a little bit more to go, and we're going to come back. We're going to talk about injectable, non-injectable, or non-insulin injectable medications. We're going to talk about insulin. We're going to talk about technology that's out there for the management of diabetes. And then the question that everybody has, right? I put a short out, and of all the shorts that I did, it was the one that has right now the most comments or views. I think it's up to like 45,000 views or something like that. Okay. And the question everybody has is, what is this diabetes remission? And what about reversing diabetes? Right? So we're heading there. We're just walking through the month. Right? So come on back. Stay with me. If you've not already done so, go ahead and watch those videos that are on the channel, on the playlist. And we will be stepping through together, because I'm giving you small bite-sized chunks so that you can walk with me. Keep an eye out for some things that we're going to be doing as we get closer to the end of the month. We'll put those out there. There's a resource that I'm going to make available to you. There's a list that you're going to be able to sign up to, so you can get some information from me as I put more things. I'm just excited about what's coming up. Okay, so be sure you stand by with me. Once again, if you haven't subscribed, go ahead and do so. Log in to your account on YouTube and hit the subscribe button, hit the notification bell so that you'll be notified when things show up on the channel. If you don't have an account, go ahead and create one and then subscribe and hit the notification bell. If you know someone who is having trouble subscribing, help them subscribe. Then hit the subscription and hit the notification bell. And then finally, just send this to as many people as you can to let them know what I'm doing as we grow the community. I want to be able to affect and be a part of the journey remember, we have 500 million people on the planet, right? I want to be a voice for change. And here on the channel, I help to educate, or I educate. I empower, and I encourage you to take charge of your health and your life, avoid complications, and go to the next level, right? Glad that you're here. Come on back and hang out with us as we get into the rest of the month. Thanks, everybody, for stopping by. Let's get some music, and let's get on out of here. Good night.